Good evening, everyone. Welcome to our Health Talk by Doc Mike. And to all the viewers, perhaps some of our viewers were confused because suddenly it appeared on our video the past episode regarding hypertension or symptoms regarding hypertension. So I was not able to delete it right away. So we've decided to do live a bit late. I don't know if we still have viewers out there. We're live both on YouTube and Facebook. Please do shout out if you could see me on YouTube and also on Facebook. And let me check my screen as well if we're live on uh, YouTube and if we are live also in. Oh, okay, perfect. So again, this is Dr. Mike. Welcome to my Health Talk by Doc Mike. Unfortunately, I need to apologize. Be sorry for all the viewers who were confused a while ago because suddenly the previous episode about the symptoms high blood pressure or hypertension was uploaded and played. Supposed to be I'm doing live, suddenly it shifted to the previous episode. But anyway, nevertheless, we need to continue what we're doing and we will discuss the symptoms of GERD. Okay, so before that, please do watch this video for all of you. So we're back. This is it. This is the real one. Okay, for the viewers out there, for both viewers on Facebook and YouTube, this is Dr. Mike. Welcome to our channel. And thank you for waiting, patiently waiting for all of you. We're live on both stream. And thank you for joining us tonight, even if you waited a bit, quite number of minutes, because previously it was the episode about high blood pressure was played. And again, if you missed that episode, at least you had a chance to watch it again. For our topic for tonight, it's all about the symptoms of GERD. Did you know that this problem, most of our patients are complaining about this? They thought it's an ulcer-like condition, but in reality, it might be this. This is the condition that we will explain tonight. What we call GERD, or we call it, let me enlarge the screen so that you could see it clearly. We call it gastroesophageal reflux disease, or what we call GERD. So that is the short name for gastroesophageal reflux disease. We call it GERD. They are just the same. So for all the viewers watching, and Mary Rose, thank you so much. Renner Rose and all. I would greet you later. Okay. So GERD, it means this is a condition, this is a problem on our digestive tract, GIT, which will affect the ring of the muscles between your esophagus and the stomach. So therefore, the structure or the organs inside the body pertaining to the digestive tract, the esophagus, okay, this part, okay, until the stomach are affected if you have this condition, GERD. Okay. So in reality, there are two major organs involved for GERD. So we have the stomach, this part, and also we have the esophagus. So to the viewers watching tonight, okay, these two major organs, anything that we eat, anything that we drink, it passes this structure, the esophagus. And this food or liquid, it would go down to our stomach. And remember, food in the stomach, it triggers the release of certain acid. Okay, we have these gastric juices. Remember that the stomach has a pH of 2, very, very acidic environment. So what happens then? For GERD, It occurs when the stomach acid frequently flows back. So the acid in the stomach, it would flow back into the tube connecting the mouth and the stomach, excuse me, which is the esophagus. So in this condition, the content of the stomach would regurgitate, would go back. So that's why there's such thing as reflux. So imagine the content of your or of our stomach, okay, it would go up, okay, and it might damage the lining of the esophagus. This backwash, or what we call acid reflux, can irritate the lining of our esophagus. So, for the viewers watching tonight, so anything too acidic, anything that we eat, anything that we ingest, particularly if this stomach regurgitate, it would have a reflux and it would go up and it would damage the lining of the stomach and also the esophagus. So now patient can experience this sudden uh, chest pain. They can they could experience that this kind of sensation, it might be related to the heart. But remember, you need to distinguish, because some of the symptoms may be related to the heart, or the symptoms is related exactly to the gastroesophageal reflux disease. Okay, for GERD, this mild acid reflux that occurs at least twice a week. For the viewers watching tonight, some of you may experience that this acid formation, it may occur at least 2 times per week, or moderate to severe acid reflux that occurs at least once a week. So again, think about it, dear viewers, to all the followers watching tonight. How many times in a week that you experience this gastric pains, this acid reflux? Is it once a week? Is it twice a week? Okay. So moving on. Most people can manage the discomfort of GERD with lifestyle changes and over the counter medications. Okay, the bottom line of having GERD is because of our activities, because of the things that we do, because the habit, the lifestyle, the way that we eat, the way we ingest liquids. Are you fond of taking coffee? Are you fond of taking soda or soft drinks? Or do you eat spicy food? Or do you take other medications that would increase this acidic environment of the stomach? So these are the consideration. But some people with GERD may need stronger medications, or there are times that surgery is required to ease the symptoms. Remember that in all cases, or in some cases, if medications will fail, doctors would do or suggest surgery to minimize the symptoms. But the question is, how do I know if I have gastroesophageal reflux? If you could see this picture, so there's a gas formation, acid formation in the stomach. Remember, if there are times that we don't take meals on time, we skip meals, or the moment that we smell the food around us, like for example, our neighbor is cooking good food and you did not eat on that specific period, then by the sense of smell, the acid in the stomach would be produced. And therefore, if there's no food inside the stomach, you didn't eat on time, this acid that would accumulate, you can see in the picture, in the stomach, it would increase in the volume and it would digest the lining of your stomach. And if in case that there's a problem on the sphincter, that's the connection, okay? That's the main valve that connect the esophagus and the stomach. And if this has a problem, the acid produced in your stomach would go up. And then it may trigger this reflux. and you would experience pain. Okay, for GERD, the most common symptom is heartburn or acid indigestion. So for the viewers watching, this is the common symptoms when the acid accumulates in your stomach. It would go up, produce so much volume in terms of the acid, and it would lead to heartburn. Okay, as if you are having chest pain, but in reality, it's the acid, not related to the heart at all. So, heartburn, for those viewers watching, how does it feel to have heartburn? Usually, patients with this have a burning chest pain that starts behind your breastbone and moves upward to your neck and throat. So, this is the sensation of having this heartburn. Okay, it's like burning pressure or pain of heartburn can last as long as 2 hours. It often worse after eating. So again, you asked yourself, dear viewers watching tonight, if after eating you still experience this and becomes worse, the pain, chest pain becomes worse after eating, okay, it might be a condition related to GERD, related to the acid accumulation or what we call heartburn. Okay, moving on. So people sometimes mistake heartburn pain for the pain of heart disease or heart attack. But there are differences. But again, you should not take for granted this problem because one is fatal. You might be considering it's a heartburn or acid indigestion, but in reality, it might be heart attack, pending heart attack. But what would be the differences? Okay, remember, heartburn versus heart disease, exercise may make heart disease pain worse. So for those hypertensive patient or patients having heart condition, sometimes we are not advising them to do strenuous exercise because if they have sudden chest pain, exercise is prohibited and rest may relieve it. However, for heartburn, the pain is less likely to go along with physical exercise. What are the symptoms? For dear viewers, this is what you're waiting for. The symptoms. What are the things that you should know about GERD or gastroesophageal reflux disease? Are you one of them experiencing nausea? So what is nausea? Okay? You are nauseated and feeling about to vomit. Some patients have these symptoms, bad breath. Bad breath is also a symptom of GERD. Troubled breathing, hard time swallowing. Okay, these are common symptoms for patients with GERD. Also, aside from being nauseated, most patients would experience wearing away of tooth enamel, or sometimes you feel that there's a lump on your throat. Most patients that I have seen, they have a complaint. One of the symptoms is they could not swallow completely, or sometimes there's a lump or a block that they experience, an obstruction on their throat, or sometimes when they swallowed something, it's a bit difficult for them to swallow, and then they feel that do I have a goiter? Do I have a mass or a lump on my throat? But in reality, when you ask them about their history and physical exam, most of this patient, okay, they have history of GERD or gastroesophageal reflux disease. Okay, most of the time you feel lump on your throat, you are nauseated, sometimes heartburn. As I have mentioned, the common symptoms for heartburn is, okay, heartburn or acid indigestion. Okay, if you have acid reflux at night, most of our viewers are experiencing this, particularly at night. You may also have the following: a lingering cough, laryngitis, okay, inflammation of your larynx, asthma that comes on suddenly or gets worse, and you have sleep problems. Okay, remember, some patients may experience acid reflux, and sometimes while sleeping, they have this sensation that they feel that there's some sour taste on their oral cavity. Okay, for acid reflux, for the viewers out there, don't take it for granted. Seek immediate medical care if you have chest pain, because some chest pain may lead to other conditions, some other problems, particularly the conditions related to the like for example, heart attack, cardiovascular problems. So you need to visit your physician, especially if you have shortness of breath or jaw or arm pain. This may be signs and symptoms of a heart attack. So once again, this is Dr. Mike. I hope you learned something new about GERD. This is a very short discussion. What is GERD? Common symptoms of GERD. And if you have this problem, don't take it for granted, because it might be another condition, particularly if you don't know how to discern between GERD and heart-related disorder. So I hope you learned something new for this night. Okay, with our discussion, let me ask, or let me check our comment section. Thank you so much for the people who watched tonight. Jane, Miss Honey, Miss Jassy, Miss Jocelyn, uh, viewers from Facebook and viewers from YouTube channel. Thank you so much. Even if we're late, even if we are delayed because of what happened, I again sincerely apologize for the wrong upload suddenly that appeared on our screen about our past episode about hypertension. That's why we are a bit delayed. But at least still information that you can watch again related to uh, high blood pressure. But actually, it's this the high blood pressure is also related to this. At least you can figure out what is the difference between GERD and high blood pressure. Because, as I have mentioned, heartburn or acid digestion, sometimes people might be thinking that it is related to the heart. Okay, Miss Jassy, JN Kurama, thank you. Miss Edna Medina, thank you so much. Jolly Bell Palasiga, thank you. For all the viewers watching on Facebook, if you have questions, feel free to ask questions. Lara, thank you so much. Ihasmin, thank you. Miss Jane, Anneng, thank you. Thank you for granting my request about GERD. Thank you too. Maria Rondeno, again, sorry for the delay. Rene Rose Besamis, thank you so much. I hope it is clear. The discussion is clear to all of you. Hello, Miss Mary Rose, thank you. Miss Wilma Ferrer Gutierrez from Chun Moon. Miss Jess, Miss Salome, Miss Jonaline, Miss Annalyn, and also Judge Swing is also watching. I don't know if they're still watching because they thought it's 9:30 in the evening, but I guess they could see this one. Casey Lau, thank you. Sally Castro Martin. For the new viewers out there, because I've been seeing new names because we're a bit late tonight. Thank you so much. I'm Dr. Mike, and thank you for joining. Please do follow us on our Facebook page. You could also be a subscriber, be part of our health supporters. Thank you so much for joining us, for helping us, particularly in helping our OFWs with certain diseases. Thank you. And also for some viewers out there, if you want to join us on our YouTube channel, you could also share, follow us, and subscribe. And if you think that this episode is useful, please do share to your friends, to your family members or loved ones. Chris, thank you so much, Chris Rodriguez. Eileen De Leon, Rowena, Mel, thank you. Miss Almira, to our super chatters, Miss Honey, thank you so much. Miss Aurelia, okay, Miss Ana De Vera, Miss Annalisa Casalta, she's also a nurse. Wow, thank you. Thank you for joining. Thank you, Doc, for granting my request about GERD. I was diagnosed last 2018 and I went to your clinic because my throat is swelling. So I was referred to UTS for neck. Um, okay, again, for those patients with GERD, sometimes we want to see what's inside. If there are some inflammation or some infections or some swelling, etc., etc., because there are some lesions on the throat because of acid accumulation. Okay, and again, you need to protect yourself because again, if you skip meals, and perhaps soon I would discuss the causes. Okay, because today I mentioned the symptoms and what is GERD all about. Perhaps soon the causes of GERD, so that viewers would try to prevent what are the possible causes of this one. Miss Noses, thank you. Yvonne, thank you so much. Miss Judith, thank you as well. For those people who are having GERD, please don't skip meals. Do not take medications, like, for example, NSAID medications that would, particularly if you don't take any food before such medications and sets, because it would damage the lining of your tummy, and it would lead to overaccumulation of the acid, and then the acid would trigger a reflux, etc. Chrisline, thank you. Miss Sharon, Miss Raisa, thank you. Miss Sonia, thank you as well for watching. Jassy, question. uh how can I answer the question? If you are having difficulty of swallowing, okay, you are having dysphagia. Okay, first we need to check what causes dysphagia. Causes of dysphagia is this one, okay? GERD is another example, or it might be having some inflammation on your throat, or sometimes you are having difficulty of swallowing. There might be a lump. So how can we have 100% correct diagnosis? Is to check what is inside, what causes this problem before we take any medication. Sometimes we do an endoscopic procedure so that we would see from the throat down there to your esophagus, because there are such cases like an obstruction because of a lump, because of a tumor of the esophagus, particularly if you have a family history of cancer, or you're having a Barrett's esophagus, inflammation of your esophagus. Okay, there are some lesions on your throat. So these are the things that we need to consider, okay, before we give the proper diagnosis. Or sometimes because of tonsillitis. So again, there are so many conditions that may have problems related to dysphagia or swallowing. Okay. Yuri, thank you so much. Fretzy, Vilma, Tesha, Casey Lau, thank you so much. Uh, well, Casey Lau, see you tomorrow. Perhaps Casey Lau is one of my students. Okay, thank you for watching. Thank you, Casey Lau, for watching. Perhaps one of my students. Honey Love, thank you so much. Maro Benalgan. Casey Lau, you might be having your exam tomorrow. Please do read your anatomy and physiology. Okay, good luck to your exam. Chris Rodriguez, thank you so much for the knowledge. Thank you so much. And Vilma, Pamela Enriquez, Annalyn, watching you from Typo. Thank you. Uh, Oh, Miss Jassy told us, based on her comment here, she was diagnosed to have gastritis. Gastritis is inflammation of the stomach. So, what causes this? Perhaps, again, the most common is uh, by taking some medications without any food intake. So, it may damage the lining of your stomach and over accumulation of acid. So this might be, or again, this may become worse if you watch our episode about peptic ulcer. If you are eating of spicy food, this may aggravate, and if you skip meals as well. Sweet Honey from Malaysia is watching. Thank you so much, Miss Sweet Honey. Miss Justiana from Vienna, Austria. Thank you so much for watching. We miss Miss Justiana because according to her, she's working at the airport in Austria. So I think it's open now in Austria, I think. So that's why she's very busy. Miss Fritzy, my colleague. Miss Fritzy Salunga, thank you so much, Miss Fritzy, for watching. Who else? Miss Ampong. Do we have medications for GERD? Yes, we have medications for GERD, but I won't discuss here. Watch out for the next episode. Soon, I will discuss the medications for GERD. But again, medications for GERD is to control the acid accumulation or the production of acid. So that's the medications that we need to control the acid. But again, if you take medications but you don't avoid the risk factors, it would be useless. Okay, Pamela Enriquez. Okay, thank you so much, Miss Pamela, for watching. Endoscopic procedure, how much? It depends. Where would you have it? If it's in a private hospital or public hospital. And it also depends whether you're here in Hong Kong or Philippines or everywhere. It's a bit pricey for endoscopic procedure unless otherwise you will be referred in a public hospital. But again, in public hospital, you need to wait. If it's not an emergency case, you need to wait. Okay. And how many months? I don't know. Months, years, perhaps. Okay, sweet honey, thank you. Miss Jassy, twice endoscopic procedure and normal, according to Miss Jassy. Okay. Philippines, they've been telling me that the endoscopic procedure, it's around 10. Okay, a bit expensive. Okay, Vilma, thank you so much for watching. I shared this episode to my husband and to my child because they have heart condition. So thank you so much. Also, ask them to watch our episode regarding uh, hypertension. Okay. Resi, thank you to all the viewers in our Facebook. Thank you so much. And also the viewers in our YouTube channel and all the supporters. Thank you so much for supporting because today we have two additional supporters. Maraming salamat po. Thank you so much. Jassy, thank you. Hazel John Adventures, thank you for watching. And also Miss Justiana, watch this episode this coming Friday. It's all about vitamin C. Okay, this coming Friday, we have an episode all about vitamin C, the symptoms or the deficiencies of vitamin C. If you are not taking vitamin C, if you have less or low level of vitamin C, what would be the effect, as well as the sources. Where can we get vitamin C? And also, do we have side effects for vitamin C? So this would be our episode this coming Friday. Okay. Uh, okay. The question of Miss Resi, why we need to ask our patient to get sedated or sleep during endoscopic procedure? Because endoscopic procedure is very discomforting. Because there's a tube, an endoscopic probe that they would insert in your mouth going down. Sometimes we need to sedate the patient. Meaning sedation is you need to calm down the patient so that it would not move or it would not have some gag reflex. Just imagine a probe, a tube inserted in your mouth going down to your tummy to visualize the field. So if you are totally awake and if patient is very uncooperative, so therefore we could request for an endoscopic procedure, sedate the patient. So that's the reason why. But if patient can tolerate it, then sometimes we don't have this uh, sedation process. We don't sedate the patient. Okay, similar with operation, right? So we need to give anesthetic agent so that patient will not feel the pain during anesthesia. So once again, this is Dr. Mike. Thank you so much for watching tonight. My apology again for the wrong upload a while ago about the symptoms of high blood pressure. So once again, this is Dr. Mike based in Hong Kong. And if you like this episode, please do share to your friends or family members. Have a great night, everyone. See you again in our next live episode. Bye.